I'm just gonna
Sarah, you might want to move.
video real quick. Take your hat off. Passive, lateral flexion, and rotation, what I was kind of briefly talking about. So your lateral flexion, you're going to do passively, so the head needs to be supported on the table. So you have your patient lie supine. And then you have to find C7, so you're going to actually palpate that underneath. Okay, so that's going to be, I'm going to kind of follow the cervical spine down to that prominent spinous process, and I can, if I'm not sure, I can bend his head up and I can feel that C7 kind of pull away from T1. And then I would draw an imaginary line to that, and that's going to be my fulcrum. So you have to kind of eye that. Then you have your stationary arm just bisect the sternum, and the movable arm is going to bisect the nose. And then I could take him passively lateral flexion to one side, okay, and then I can take my measurement, right, which is 32 degrees, and then passively take him back, okay. Rotation, come around this way so you can see from this direction. Rotation, if you guys want to look over here, it's the same as what you did with your patient sitting, except now they're supine and I can passively rotate. So I'm going to pick a point right in the middle of the round top of the head. My stationary arm is going to be between the acromion, or you could go perpendicular to the floor as long as the shoulders stay flat on the table, because really they should be pretty level, pretty parallel to the floor. And then bisecting the nose, okay? And so then I could take him to rotation, so I could just rotate his head passively, just relax. We'll just move it as far as it'll go, okay? I'm going to keep my hand on him, so I'm not just going to let go of his head there. And then I've got to get my goniometer to line up with those things. And he's got, I got to subtract. Take out. I don't want to leave him there too long. 62 degrees. Okay. And keep in mind that leaving someone in a fully rotated or side bent or flexed or extended position for more than just a few seconds could cause problems. So you don't want to leave them there too long. And if you're having a hard time, just bring them out of it, figure out what you need to do, and then do it again so you can get your measurement quicker. Okay?